Hello classmates, welcome to the online class of Chinese Medicine Gerontology. Today we will study the first part of congestive heart failure. First, let's understand the definition of congestive heart failure. Congestive heart failure, CHF, is a very common clinical syndrome in elderly patients with end-stage heart disease. It is designed as congestive heart failure. Referred to as heart failure is due to cardiac structure or functional disease resulting in impaired ventricular filling and ejection ability. Cardiac output cannot meet the body's metabolic needs, with pulmonary circulation and systematic congestion. Insufficient blood perfusion of organs and tissues is a group of clinical syndromes, mainly manifested as dysphonia, restricted physical activity and fluid retention, coronary artery disease, hypertension, cardiomyopathy, valvular disease, and pulmonary heart disease are the main causes of heart failure in the elderly. Almost all heart disease will eventually develop into heart failure. If the disease can be treated in a timely manner in the elderly stage, it can delay the progression of the disease in the middle and late stages. The disease is complicated and difficult to treat, and the general prognosis is poor. The disease mostly belongs to the category of chest paralysis, palpitations, asthmatic syndrome, anemia, and failure. When myocardial systolic dysfunction occurs, the most fundamental problem is decrease in cardiac output, causing hemodynamic disorders. The compensatory ability of each compensatory mechanism that maintains cardiac function is limited, and long-term maintenance eventually leads to decompensation, can cause heart failure. Myocardium is often compensated by Frank-Starling mechanism, myocardial hypertrophy, neuroendocrine regulation, and ventricular remodeling under chronic ischemia, hypoxia, and excessive pressure. When the final decompensation is maintained for a long time, irreversible heart failure occurs. The clinical symptoms progressively worsen. At the same time, we should note that elderly heart failure has the following pathological characteristics. Cardiac output is significantly reduced. Hypoxemia is more likely to occur, and the response of heart rate is low. Therefore, elderly patients often have atypical symptoms when heart failure occurs. Elderly people often adopt a quiet lifestyle, lack of physical activity, and do not experience labored breathing difficulties. Some elderly people have paroxysmal dysphonia during the day. After eating or exercising, the meaning is the same as paroxysmal dysphonia at night. Older people with moderate heart failure can be completely asthmatic. Once there is a cause, acute left heart failure can occur, or non-specific symptoms are common. Fatigue, gastrointestinal symptoms, neurologic symptoms, etc. may suggest clinical manifestations of heart failure. Dry cough in the lying position and reduced sitting position. Less urine during the day and polyurine at night. Unusual sweating on the face and neck. There is also poor size specificity. Jugular vein dilation and apical pulse displacement cannot be used as indicators of heart failure. The heart rate of the elderly can be unpleasant when heart failure occurs, or even bradycardia. Weight loss in the lungs do not necessarily represent heart failure manifestations, because they may be associated with chronic bronchitis or other lung disease. Angioedema in the elderly can be seen not only in heart failure, but also in low activity, chronic venous insufficiency, and hyperproteinemia. How does Chinese medicine understand the etiology and pathogenesis of coronary heart disease and angina? The disease is mostly caused by diseases such as palpitations, chest paralysis, coughing, and wheezing syndrome, and chronic heart disease and due to old heart failure, blood loss, blood stagnation for blood stasis, water for drink, harm and 5 internal organs, exogenous evil, other disease, fatigue, emotions, and improper medication are often the factors that induce or aggravate the disease in the heart, involving the lungs, liver, spleen, and kidneys. The basic pathology is based on deficiency and mixed with hyperfunction. Deficiency is mainly due to yang deficiency, but blood stasis, drink water, a cold, heat, and film. 正虚 and evil facts interact with each other to form the deficiency and truth of heart failure, kidney deficiency, lung deficiency, spleen deficiency, qi stagnation and blood stasis, venous paralysis, overflow of water and drink, and lung and heart disease, miscellaneous syndromes. Immunocrisis of heart failure and heart failure. Below, briefly talk about the main points of diagnosis of heart failure. According to a definite organic heart disease, diagnosis can be made in combination with symptom signs, laboratory and other examinations. Generally, dysphonia in left heart failure, jugular vein enlargement in right heart failure, hepatomegaly and prolapse edema are regarded as an important basis for diagnosis. Dysphonia is the most important symptom of left heart failure in the elderly, which can be expressed in different degrees as follows. Dysphonia with exertion, paroxysmal nocturnal dysphonia. If a complaint by asthma can be called cardiogenic asthma, which is an early typical manifestation of left heart failure. Those who are mild can be relieved within a few minutes after sitting up, and those who are severe may be accomplished by cough, foamy sputum, and even acute pulmonary edema. Sit and breathe. Severe dysphonia when lung congestion reaches a certain level. The elderly are more prone to low cardiac output and hypoxemia during heart failure. We reduce the oxygen supply capacity to various organs, presents various clinical symptoms, or is incomplete by confusion and various complications. Making a diagnosis, prior attention should be paid to the analysis of symptoms, signs, and medical history. In the above, we have learned the understanding of Chinese and Western medicine on the etiology, pathology, and diagnosis of congestive heart failure. We hope that students would carefully sort and summarize after class. Okay, that's all for today's class. Thank you all.